Hi, this is QD Clinic, and I'm Jack Cush with RheumNow.com. QD Clinic is brought to you by RheumNow.live, March 2021, a cool, keen, connected CME conference. Be there. At the end, I'll tell you about our special faculty. Today's case is about when to do genetic testing. This just came up with a recent email I received from a colleague asking me to comment on a case. The case was a 29-year-old male who'd been having fevers for a few months. The fevers were up to 102. They would last, he said, up to a week, would go away and then come back a few weeks later. So there was this periodicity to it, although it was sort of irregular as to how it was behaving. But it seemed like he needed high-dose steroids to control the fevers. The question was, what did he have? The workup was pretty unrevealing. And my first comment to him was, he's not going to have Still's disease. I don't care if he meets Yamaguchi criteria. He doesn't meet Cush criteria. Doesn't matter what criteria. He can't have Still's disease or systemic JIA or AOSD because he doesn't have a daily fever that's quotidian, meaning greater than 102, occurring every day with no breaks. That's what happens in systemic JIA and Still's. It goes on for months and months and months. Also giving you daily fevers would be something like Schnitzler's syndrome, which happens in adults. So the question is, what does he have by having this intermittent fever? My answer is, get a genetic test. Get an autoinflammatory panel, and I'll tell you how to do that at the end. When should you consider doing an autoinflammatory gene panel? You can order a single gene like the MEFV gene for familial Mediterranean fever. It'll take you 6 months of bickering with your insurance company and figuring out who's going to do it, how much you're going to pay for it, thousands of dollars likely. There are easier ways, but the real question is, who should get a gene panel? These are my rules. Number one, the patient really needs to have features of an autoinflammatory disease. Having some criteria, not all, but certainly not none, or certainly not one, that would prompt such testing. Having some criteria means they should have fevers that are otherwise unexplained. Rashes, those can be, especially if they're urticarial, pustular, or what's the other thing I wrote down here? Urticarial, pustular, or intermittent, meaning they come and go. Other features would be serositis, inflammatory labs, CNS involvement, hepatosplenomegaly, lymphadenopathy. You don't need to have all of them, but you need to have several of those to make one of the many autoinflammatory syndromes a consideration. Second, you should consider it when the fever, like this case, is not daily. When it's daily, then it could be Still's disease, and there is no gene test. But when it's not daily, when it's lasting 2 or 3 days, or a week, or 2 weeks, and then goes away, and then comes back, that's the panel that you want to order in such patients. When there's a periodicity, meaning it recurs every month, every 3 months, that also suggests a genetically determined disorder. When it happens in the very young, since infancy, or basically as a child, and these have continued on since, or if it's happening in a child, you would consider an autoinflammatory panel. A family history would be a good reason to do this. And lastly, failure to respond to either colchicine or steroids or an IL-1 inhibitor. These would be reasons enough to, in my mind, to exclude an autoinflammatory condition when they certainly don't respond to usual medicines that work in autoinflammatory disease. So what do I recommend? I recommend going with an outfit called Invitae.com. That's INVITAE.com. You can order an autoinflammatory panel for $250. They will bill the patient. The patient will pay for it, but it's going to get done quickly. And it's 72 genes, at least half of which have been associated with known autoinflammatory disorders. You have to be registered as the physician, the ordering physician, and put in the patient information and order the test, and then they will contact the patient, send them the kit to draw the blood, etc. And then 2 or 3 weeks later, boom, you've got your answer, or you don't. The interesting thing about autoinflammatory diseases is that even in the best of clinics, like the NIH Autoinflammatory Clinic run by Rafaela Golbach-Mansky and others, about 60% of their patients that they follow, they seem to clearly have autoinflammatory type disease, yet don't have a genetic diagnosis. Again, 60% will not have yet had a genetic diagnosis. But as you know, if you follow the work of Rafaela or Dan Kastner and others, they're always coming up with a new syndrome. This year it was the somatic mutation associated with the VEXAS syndrome, VEXAS, interesting syndrome. They sort of look like relapsing polychondritis patients with fevers. Anyway, I think you should consider a genetic panel like this through Invitae.com. There are others that you can find that will do testing. Actually, I tweeted this recently. I tweeted it from a slide from Susan Chenoy from the University of Seattle, giving a great talk at RWCS. And I have a slide on the 4 or 5 companies that do genetic panel testing. But Invitae is clearly the most cost efficient of them, in my opinion. So that's it for this case in QD Clinic. Again, our fabulous faculty, truly stellar. Just a few. Ian McInnes is going to be our keynote speaker and is also going to give a small TED Talk. His keynote is called "'Twas the Best of Times and the Worst of Times." It's sort of a reflection on what's happened in the last year, and who better to do that than Dr. McInnes. Also from the EU, Frank Bouderet, who's going to talk about prednisone. Frank's from Germany, has been working on steroids a long time, has a lot of interesting things to say about steroids, and he's going to do it all in 15 minutes. Others would include COVID talks by Philip Robinson on the Global Rheumatology Alliance. He's one of the principal leaders in that effort. And Beth Jonas from the ACR Program Directors Group, who's going to talk about changes in education during COVID. And lastly, we're going to have a session on RA killers with Jeff Sparks talking about ILD in RA, and I'll be talking about pneumonia in RA. That's RheumNow.live, March 2021. See you there.